It's important to floss a rubber dam clamp. This is so that you can easily retrieve the clamp should it be displaced or broken whilst during placement. So you need to take a long piece of floss and thread the end through the small hole on one side of the clamp. And pull through quite a long piece. And then wrap this end round the arch of the clamp a few times. And then take the other end of the floss and thread it through the small hole on the other side of the clamp. So now your clamp's ready to be used in the mouth. So normally a rubber dam clamp and the dam would be placed in one movement together. But for the purposes of this demonstration, we're going to look at placing the clamp on its own, just so that we can see clearly where the clamp is meant to be placed. So once you've selected and flossed the correct clamp, use your clamp forceps, place the tip into the large hole, and if you squeeze the handle of the forceps together, that opens the clamp up and allows you to slide it down over the tooth, and if you release the handles, it'll then squeeze together and hold itself round the selected tooth. And then if you place a finger either side and apply gentle pressure, that'll be able to check that it's properly in place. So the clamp needs to sit at the gingival margin. If it's too high, it'll slide up over the bulbous crown and come off. And if it's too low, it'll sit on the gingivae and cause some trauma. With the template for guidance, use the punch to create a hole in the rubber dam. This hole will allow the tooth to be isolated within the mouth. So stretch the dam in one hand to open up the hole, and then slide the wings of the clamp underneath the dam. This means that the dam and the clamp will be held together during placement. Make sure you've correctly identified which tooth you want to isolate, and then using the forceps, slide the clamp down over the tooth as we discussed previously. So now you can stretch the dam over the frame. The curve of the frame needs to face outwards and follow the contour of the patient's mouth, and the bar should be along their chin, not underneath their nose, as this tends to cause irritation. Make sure the floss is kept outside of the patient's mouth. So at the moment the dam's still sat on top of the wings of the clamp, so if you use your finger and a flat plastic to slide it off the wings, and then the dam will sit neatly round the neck of the tooth with the clamp sat on top. And sometimes you need to adjust the dam a little bit to make sure that you've just got that one tooth you're working on isolated. So this rubber dam placement isn't correct because the dam still sat on the wings, whereas this one is correct and you can see it sat neatly round the neck of the tooth. So now the rubber dam's ready to use, and you can slide a saliva ejector in underneath it just to increase patient comfort. So to remove the dam again, just take your forceps into the clamp and squeeze it, and the clamp should come off with the dam altogether. It's always a good idea to have a tissue to hand, because often patients need to have a wee wipe of their face. So we've looked at isolating one tooth, but if you're working on more than one tooth, or if you're working into proximal areas, you will tend to need to isolate more than one tooth. So to do this, you would just cut as many holes as you need in the dam initially, and then you can use a clamp to secure the dam to the most posterior tooth you're working on, in this case the 6. Expose the teeth in front of it and then use a wedgie or a rubber strip just to hold the anterior point in place.